Welcome to our advanced pharmacology group video assignment on our chosen medication. So the medication we chose is from my mother who has heart failure, so she takes a multitude of different drugs for her condition. And the specific drug that we chose is bisoprolol, which is sold under the brand name Concor. And she takes this for for a condition because it helps with her high blood pressure, which is also known as hypertension, and irregular heart rhythm, which is also known as arrhythmia. So starting off with the pharmacokinetics of Concor, which is what the body does to a drug, I'm going to go over the four familiar processes of ADME. So starting with absorption, Concor is given as the oral drug. It has an initial dose of 5 milligram, but depending on your condition, your physician can prescribe up to a maximum of 20 milligrams per day. Concor has a very small first pass metabolism rate of approximately 10%. Therefore, it has a high bioavailability of approximately 90%. Concor is very extensively distributed in the body with a volume of distribution of 3.5 liters per kilogram and has a plasma protein binding of 30%. So it's very easy for it to then exit the blood vessels. So you need a higher dose to achieve a given concentration. Moving on to the metabolism, Concor goes through the oxidative pathways and is not conjugated. The metabolites of the metabolism are very polar and are excreted through the urine because they're hydrophilic. And in terms of the elimination, Concor has a high total clearance of 15 liters per hour and an elimination half-life of 10 to 12 hours. The Concor is eliminated in two different groups. Around half of them are unchanged, and the other half are demetabolites. Both groups are hydrophilic and are excreted renally.
Now moving on to the pharmacodynamics, which is what a drug does to the body. Bisoprolol is an active ingredient of Concor, and through blocking cardiac beta receptors, it reduces the response to sympathoadrenergic activity. Acute treatment decreases cardiac output and oxygen consumption by lowering heart rate and stroke volume. Following the initial rise, the peripheral resistance declines in chronic administration. One of the potential mechanisms of action behind the antihypertensive impact of beta blockers is the suppression of plasma renin activity. Bisoprolol is a beta-1 selective adrenal receptor blocker that has no useful intrinsic stimulating or membrane stabilizing effect. It only has a very weak affinity for the beta-2 receptors involved in metabolic regulation, as well as those found in the smooth muscles of the bronchi and blood vessels. Therefore, it is generally not predicted that bisoprolol will affect the effects of beta-2 on metabolic resistance and airway resistance. The therapeutic dose range is not the limit of its beta-1 selectivity. Heart rate, contractility, and blood pressure are all decreased by bisoprolol. According to the findings of numerous clinical studies, bisoprolol lowers cardiovascular mortality as well as all-cause mortality in people with heart failure and a low cardiac ejection fraction. And these are the side effects of bisoprolol. They include nausea, headache, decreased heart rate, fatigue, constipation, diarrhea, dizziness, and cold extremities.
Moving on to alternative options of the Concor, which can be described as the lisinopril, is used as another because it has the benefit of helping to protect the kidneys. It is at the SEE inhibitors. It blocks the production of chemical that tightens the blood vessels. Without this chemical, blood vessels relax, lowering the blood pressure. If patient has a renal disease, bisoprolol should be replaced with alternative medications such as diltiazem or verapamil. Diltiazem is a calcium channel blocker. It works by affecting the movement of calcium into the cells of the heart and the blood vessels. This relaxes the blood vessels, lowers the blood pressure, and increases the supply of blood and oxygen to the heart while reducing its workload. Verapamil is a phenylalkylamine calcium channel blocker used in the treatment of high blood pressure, heart arrhythmias, and angina. Verapamil dilates the renal artery. It increases the renal blood perfusion and protects the kidney function and therefore improves its work. Moving on to some facts about the drug. Erupting creating of bisoprolol can significantly precipitate angina, chest pain, and other unwanted heart conditions such as myocardial infarction. Therefore, it should be always be tapered off progressively for at least a week. This is due to potential of rapid raise in blood pressure, your chance of having heart attack and stroke increases as a result. Regarding of how much bisoprolol travels in breast milk to the baby, there is currently no research-based evidence. However, breastfeeding moms are warned against it since it might cause the baby's heart rate to dangerously slow down or possibly cause the blood sugar level to drop. And beta blocker like bisoprolol can potentially reduce cardiac output and renal perfusion. This mechanism can usually exacerbate renal dysfunction. Thus, bisoprolol can lead to progression of renal disease. Hence, if the patient has been diagnosed with the kidney condition, then an alternative drug has to be chosen as listed in previous slides.
Okay, so here's our reference list, and with that, our video comes to an end. Thank you for watching.